dissection of my sheep heart, the pericardium or epicardium, the apex, the right atrium, which is deoxygenated, and the left atrium, which is oxygenated. The left auricle, the right auricle. These are used to increase the volume of blood that it's able to hold. They're on the outer walls of the atria. Here is the left ventricle and the right ventricle. The interventricular sulcus. The two major blood vessels are the great cardiac vein and the anterior interventricular artery. This is the pulmonary trunk. Mine is cut extremely short. It's right here. And it is oxygenated and going to the pulmonary capillaries. My aorta, here. It is going to the systemic capillaries in the body tissues. It is oxygenated. The ascending aorta, here. The aortic arch and its three major vessels. The brachiocephalic trunk, the left common carotid artery, and the left subclavian artery. The superior vena cava and the inferior vena cava, I'm afraid I'm having a hard time with. They should be here. And I don't see anything coming into or out of the heart. So I'm going to move on to the next. The coronary sinus here. Somewhere the superior vena cava and the inferior vena cava run through this, and I'm still not able to. Okay, they all the vessels go to the right atrium, and the vessels are veins, and they are deoxygenated. I'm going to show some of the internal anatomy. The pectinate of the inner wall of the right atrium is this here. The myocardium of the right and left ventricle. It's the right ventricle, myocardium, left ventricle, myocardium. And the reason the left is so much larger is because it pumps to the largest of the arteries in the body, and it's a muscle, so it's larger. The trabeculae carneae on the inner surface of the ventricle. Here. Right. Is my thumb in the way? Okay. There. Open this up. Get the other side. It didn't do you a lot of good, did it? here, and here. The trabeculi carnea on the inner surface of the ventricular. Here. The intraventricular septum. Here. Here. The bicuspid and the tricuspid bicuspid here, tricuspid here, chordae tendineae here, cusps of the valve, okay, stop, aortic, semilunar valve, the pulmonary semilunar valve, here it's cut in half, the papillary muscle, let's see, I have it so filleted here, hard to tell where everything is. The muscle, the papillary muscle. Okay, right here, here,